Good morning. My name is Juan Fernando Iglesias. I'm working as a consultant in interventional cardiology at Geneva University Hospital, Switzerland, and I am co-principal investigator of the BIOSTEMI randomized clinical trial.
So far, almost all the drug-eluting stent trial have been designed to prove non-inferiority. And this kind of seems to be representative for the mature status of the DES technology and its clinical evidence. Could you tell us a bit why you specifically choose a superiority design for Orso in the BIOSTEMI trial?
In the pre-specified subgroup analysis of patients with ST elevation myocardial infarction included in the multi-center investigator-initiated non-inferiority BIOSENSE trial, we found a signal towards improved clinical outcomes with respect with the primary endpoint target lesion failure in patients treated with biodegradable polymer sirolimus eluting stent at 1 year. Therefore, in order to acquire more precise and concrete data on the potential benefit of the stent design in patients with STEMI, we designed a randomized clinical trial aiming at demonstrating the superiority of the Osiro biodegradable polymer sirolimus eluting stent over the Xience durable polymer everolimus eluting stent.
So please let us know, what are the key outcomes of the BIOSTEMI trial at 1 year follow-up?
At 1 year of follow-up, we found that the cumulative incidence of the primary endpoint target lesion failure was 5.5% among patients treated with the durable polymer everolimus eluting stent and 3.9% among patients treated with the biodegradable polymer sirolimus eluting stents. This represents a 1.4% absolute risk reduction, a 41% relative risk reduction, and importantly, this met the pre-specified criterion for superiority of the biodegradable polymer sirolimus eluting stent over the durable polymer everolimus eluting stent.
BIOSTEMI is the first randomized trial to compare two newer generation drug-eluting stent and STEMI. So what do you think is the impact of this trial outcome for daily practice?
I think that this trial is a landmark trial in the field of interventional cardiology. As physicians in charge of developing coronary stent trials, we have to provide robust evidence on potential benefits of devices among subgroup of patients. BIOSTEMI is the first randomized clinical trial comparing head-to-head two newer generation drug-eluting stents, but BIOSTEMI is also the first randomized clinical comparison of two new generation devices among the high-risk subgroup of patients with ST elevation myocardial infarction. And this subgroup represents a high-risk patient subgroup at increased risk of both patient and device-oriented clinical outcomes. And this clearly represents an unmet clinical need in the contemporary clinical practice.
So should then Orso be the first choice for patients with STEMI who undergo primary PCI?
The choice of a drug-eluting stent for the treatment of coronary artery disease among patients has to be driven by robust clinical evidence. And I think that with BIOSTEMI, we have provided the community with clear randomized clinical data showing that the Osiro biodegradable polymer sirolimus eluting stent is superior to the durable polymer everolimus eluting stent. So therefore, I mean, this is now up to the physicians to decide whether these data are relevant or not. But I think that we cannot just close our eyes and we have to face these results as they are.
Thank you very much for providing these insights
Thank you.
and having taken the time for this interview.
Thank you.